The doctor said my symptoms were psychosomatic and I needed therapy. I'm a doctor and I have stage 4 cancer. Dr. Kieran Foster sat across from me in his pristine office at Sterling Medical Center, his hands folded on the mahogany desk between us, his expression radiating the kind of practiced compassion that immediately set my teeth on edge. I just finished explaining my symptoms for the third time in 6 weeks. The bone pain that woke me at 3 a.m., the persistent cough that had progressed from occasional to constant, the weight loss of 23 pounds despite eating normally, the night sweats that soaked through my sheets. Foster nodded along, his eyes not quite meeting mine, and then he said the words that would haunt me for the rest of my drastically shortened life. Dr. Reeves, I think what we're dealing with here is acute anxiety manifesting physically. Your position as Chief of Emergency Medicine at County General is incredibly stressful. You've been working 80-hour weeks for 15 years. Your body is telling you to slow down. He pulled out a prescription pad. I'm recommending cognitive behavioral therapy and a low-dose anxiolytic. 6 weeks of treatment, and I'm confident these symptoms will resolve. I stared at him, my medical degree from Johns Hopkins suddenly feeling worthless in this room. Dr. Foster, I specifically requested a CT scan of my chest and abdomen. I have a persistent cough with occasional hemoptysis, unexplained weight loss, and bone pain in my spine and ribs. These are red flag symptoms that warrant imaging. My voice stayed level, professional, even as fury built in my chest. Foster smiled that patronizing smile I'd seen male doctors use on female patients countless times. I understand you're concerned, but ordering unnecessary scans contributes to healthcare costs and patient anxiety. Your physical exam was unremarkable. Your basic labs were within normal limits except for slightly elevated inflammatory markers, which is consistent with stress. I've been practicing for 23 years, Dr. Reeves. I know the difference between organic disease and psychosomatic symptoms. He stood up, signaling the appointment was over. I remained seated. I'm not requesting these scans as an anxious patient. I'm requesting them as a physician who recognizes concerning symptom patterns. My inflammatory markers have been trending upward for 3 months. I have night sweats that aren't explained by menopause. I cough up blood. Foster's smile tightened. And I'm telling you, as your physician, that your symptoms are stress-related. Take the prescription, see the therapist, give it 6 weeks. I left his office without the prescription, my hands shaking with a combination of rage and fear. I'd come to Foster because he was supposedly the best internist in the hospital system, highly recommended by colleagues. What I'd received instead was medical gaslighting from someone who'd decided my legitimate concerns were hysteria. I drove straight to County General, where I'd worked for 12 years, and found Dr. Yuki Tanaka in the radiology department. Yuki and I had trained together as residents, had covered each other's shifts through pregnancies and family emergencies, had celebrated promotions, and commiserated over hospital politics. She took one look at my face and pulled me into her reading room. What's wrong? I told her everything, watching her expression shift from concern to anger. Foster's an idiot. You know what those symptoms mean, Elena. Why are you letting him blow you off? I'd been asking myself the same question, maybe because part of me wanted him to be right, wanted this to be anxiety that could be fixed with therapy and breathing exercises. I need you to order the scans, today if possible. Please, Yuki. She was already pulling up the ordering system. Consider it done. And Elena, whatever this is, we'll figure it out. The CT scan happened 4 hours later. I changed into a hospital gown in a room I'd sent countless patients to, lay on the table I'd explained to frightened families, and held my breath when the technician told me to. The machine whirred and clicked around me, capturing images of my insides in thin slices. I knew what the scan could show. I'd read hundreds of them in the ER, had learned to spot the telltale signs of tumors and metastases. After it finished, I dressed and went back to work, throwing myself into the chaos of the emergency department because it was easier than waiting for results. A 16-year-old with a compound fracture, a 53-year-old having a heart attack, an 80-year-old with pneumonia. I treated them all with the same focused intensity I always brought to work, but part of my mind stayed on that imaging suite, wondering what those pictures showed. Yuki found me at 11 p.m. in the break room, staring at cold coffee. Her face told me everything before she spoke. To see the full story, click the link below or go on my channel.